My name is Nick, and I'm reversing type 2 diabetes. I was diagnosed 24 years ago, having just come off an intensely stressful time working as production supervisor on the movie Evita. I was told I'd be managing diabetes for the rest of my life. It became crazy. I was injecting myself with insulin in the stomach 4 times daily, and it was getting worse. It's this idea that you have to live with it, when in fact you can reverse it.
Reset Health is a carefully designed program by leading medical experts and researchers, bringing specialist doctors, psychologists, dietitians and nurses into a protocol to help reverse type 2 diabetes and obesity.
Up until now, the common treatment for type 2 diabetes is designed to maintain blood glucose through multiple medications, which includes insulin. At Reset Health, we show you how to lower your insulin resistance and help reverse your type 2 diabetes. Not surprisingly, this can also work for obesity.
We start by taking a medical history to understand metabolic health, looking at blood profiles, accessing nutritional information, sleep, physical exercise, and then provide you with an individualized program that sets 3 key targets for metabolic health from several possible measures, including blood glucose, body weight and BMI, blood pressure, cholesterol, and liver tests.
Within Reset, we combine the latest nutrition research with cutting-edge fasting protocols to meet your unique needs. Obesity and type 2 diabetes are both complex chronic diseases. For anyone making changes to their lifestyle, it's a very personal and emotional journey. I'm a senior specialist dietitian who has worked with people living with obesity and diabetes in both the NHS and academia, and understand the challenges people face when making lifestyle changes. At Reset Health, our team will be here to guide and support you along this journey.
I have just spent 15 weeks helping the Red Cross and Los Angeles School District with their scheme to feed 500,000 kids a day. These children rely on school meals to avoid going hungry. We've served over 40 million meals so far during this pandemic. Reset Health has restored my health so that I can now help others.
I was in charge of some 15 COVID wards, and it saddens me that a large proportion of those who unfortunately die are patients with type 2 diabetes and obesity.
Having just worked throughout the COVID-19 pandemic, I was witness to something which wasn't so obvious before, that the epidemic that actually we are suffering from is obesity and diabetes. I spent 2 weeks of the peak in ITU supporting my ICU colleagues, and seeing the types of patients that were on ventilators was stark, because I think about 90% of them had diabetes.
The alarming figure is that 1 in 4 COVID-19 deaths are diabetics. This makes me so relieved that I've changed my relationship with food and reset my own health.
Good evening, everyone, and welcome to today's talk show, Reversed Obesity and Type 2 Diabetes with Roczen, brought to you by Malaysia Kini's Health Matters, where we delve deep into the most pressing issues surrounding wellness and well-being. So I'm your host for tonight, Nadia Nazir, and tonight we're tackling a topic that affects millions worldwide. That's obesity and diabetes. And we have with us this evening 2 renowned experts joining us to share their insight and strategies for overcoming these health challenges. But first, let's meet our distinguished guests. So our first guest is a consultant endocrinologist and head of endocrinology unit, Hospital Putrajaya. And please give her a warm welcome, Datuk Dr. Zanariah Hussein. Did I pronounce it correctly? Endocrinologist?
Perfectly, Nadia. Thank you very much for the kind introduction, and happy to be here, with all to share some very important, current opinions in this topic. Thank you.
Thank you so much for joining us. It's absolutely our pleasure. So next, we're privileged to have with us the Head of Clinical Services of Reset Health. Please welcome Dr. Nick Adzrul.
Thank you, Nadia, for the introduction. I'm so happy to be here to be able to share about our work the past couple of years in reversing obesity and diabetes among Malaysians.
Can't wait to talk to you about it a lot more. There are also probably a lot of questions in the audience out there, such as, is it possible to reverse diabetes? We've heard about this, but is it really possible? And also obesity. So now is your chance to ask your questions for those of you who are watching right now in the comment box and share this live with your loved ones. So now relax, sit back, and prepare to be enlightened as we dive into this vital discussion. We would like to start with Dr. Zanariah. So, Doctor, as per our show's title today, what does reversing obesity and diabetes mean?
Yeah, so maybe a little bit of intro. There was a lot of good information in that starting video just now. But as mentioned, obesity and diabetes are the twin pandemics that we have been facing for years, and it's, becoming a increasing problem. So I think we know that in Malaysia, we know, or we don't know, but I should tell you from our national surveys, that 1 in 2 Malaysians are either overweight or obese, adult Malaysians above 18. That was from a survey back in 2019. So the latest survey last year is yet to be unveiled, the results, but soon you will know. And diabetes also hits a fair number, about 1 in 5 adults. So, we used to think, and also I probably need to show that there is a strong link between obesity and diabetes, so much so that if you are obese, about a quarter of you can become diabetic. So there's this close relationship. We used to think that diabetes, once you get it, it's a life sentence. You may get diabetes that's mild, although some people are already diagnosed late with moderate to severe diabetes, but usually mild, and then your glucose levels go up with time, and you used to be on just diet control, and then it fails, and you're then on one type of medication, and then it goes on to 2 and maybe 3, and after some years maybe your doctor will say, oh, your glucose is high despite your medicines, and therefore you need to graduate to insulin or injections, and that seemed to be like, oh, that is it, it's a life sentence. You need to, the glucose will progress, complications will come, and medication gets more. But what we have learned in quite some time, maybe a couple of decades, maybe more, but initially with measures to reduce weight in a big way, and in the past they've had studies on lifestyle intervention. But what told us is that about surgery for weight loss, that has been done over the years. So when they did these studies, they showed that if you lose a lot of weight, that you could actually reverse things like diabetes, high blood pressure, many other things that are weight related disease. But in the recent past, in the last few years, we know that lifestyle interventions, focusing on actually getting together a good nutritional management or diet, physical activity, all in a sort of a structured way and maintained and monitored. And this was found in studies, or what they call clinical trial, could result in quite significant weight loss. And they then can measure it that we actually were able to stop medications entirely, yeah, and then the sugars go right back to normal. It reverses to normal and stays normal for some time, a few months, without medicine. And that's what they coined the term diabetes remission. Cancer remission. So you get rid of the cancer cells, so you get rid of the glucose, and this can only happen if you get things right at the actual level where things are not working, which is the pancreas. Yeah, so the pancreas produces insulin. So, and they've done these studies very nice recently to show that the pancreas recovers, which is so good. So I think people should know that if they manage to lose a lot of weight and maintain it, that the pancreas can recover in some individuals. Yeah, and then they can go back to a normal, no diabetes. Yeah, but the caution is that if they gain back the weight, then it can relapse, just like cancer can relapse, the diabetes can relapse again. So they've used this term interchangeably, remission of diabetes or reversing diabetes. But I think it's also good, even if you can't reverse diabetes completely 100%, but the fact that you can do lifestyle intervention or what other measures to lose weight, and you can have less dependence on medications while you are doing more on lifestyle and losing weight. So your medication list can come down, and in some individuals with the right advice and support, it possibly can even be stopped at the right time. Yeah, so that is the concept about reversing diabetes, and closely it's to do with weight management. That's very important. So I guess in the same mouthful, you would say reversing obesity and type 2 diabetes. Yeah, so maybe that's what I want to say for the beginning. Yeah. All
I
right.
think that as Malaysians, it is particularly difficult to do this because, of course, people who have health issues, any kind of health issues, when they go and see the doctor will always, first thing they would say is like, try and lose some weight. And then we go like, yeah, I'm on a diet. And then it goes on for a week. And then after that, we slowly go back. So how significant is the role of lifestyle interventions in managing and potentially reversing obesity and type 2 diabetes, doctor?
Yeah, so when we coin the term lifestyle intervention, program, it's not just plain giving a lifestyle advice like you just mentioned. Doctor sees you and he says, okay, go back, try to lose weight, get your diet together, try to exercise more and move more. And that's quite general, and that's why it doesn't work, because it's too general. And that's, you give that as a public message maybe. But when you have a patient with diabetes, obesity, and you really want to aim at weight reduction for better outcomes, clinical outcomes, is you've got to give they call it individualized sort of kind of a prescription for lifestyle intervention. And lifestyle intervention just denotes non-drug or non-pharmacological, because drug is pharmacological therapy, and that encompasses nutritional management, aka diet, physical activity, which not only includes going for exercise, but just moving more. Yeah, and then it also includes in the end, weight management and behavior therapy. Behavior therapy is sometimes something that we don't emphasize much, and we don't do counseling properly with the right, well-trained, qualified persons, like probably like a lifestyle coach, or physical movements, how to organize your sleep, how to organize your hydration, how to organize your stress. So all that actually is under the umbrella of lifestyle intervention. And for diabetics per se, we also have this term called DSMES, so diabetes support and education. So having diabetes specific education is important. And it's delivered by not only doctors, but we also have what we call nurse educators, dietitians as well, who are all in the business of educating the patient. Yeah. Yeah. So lifestyle intervention is really important. It's a term that we say so lightly, but it actually means that we, by right, should have in place a structured program of a significant duration of time and a significant intensiveness. That means you're seeing the patient at regular intervals. And in these days, it might not be physically, it could be in a virtual sense. and you're actually instilling concepts of motivation, to the patient to keep on, because that is what is really necessary in this chronic disease management. uh, you know, um, uh, yeah, so that's probably a bit of concepts that I want to say.
I think this is life changing. Just hearing about this for most of our audiences as well, because I have my late grandmother herself had diabetes, and unfortunately, we are all from Kelantan, and we love our food, and we love a lot of sugar in our food. And so, Dr. Nick, can you tell us a little bit about what exactly is Roczen, and how does Roczen approach this lifestyle intervention that we've been talking about to reverse obesity and type 2 diabetes?
Okay, thank you, Nadia. So Roxanne is here to sort of fill the gap, like what Dr. Zanariah has mentioned previously in her answer. Basically, lifestyle intervention can be easy to prescribe, but not easily executed by the patient without proper guidance. So our program, Reset Health Program Roxanne, is a medical protocol addressing the medical issues of obesity and type 2 diabetes. So it is led by doctors. It's an active lifestyle management program where we will prescribe some lifestyle behavior changes, and the patients that enroll in the program will undergo this prescribed lifestyle intervention. And we do it virtually, taking because it can be scaled up quite easily beyond the normal physical setting. We can see patients spread out all over Malaysia. We are seeing patients in Johor, Penang, even Singapore, and overseas as well, because what we're doing is coaching them in terms of lifestyle intervention. And it's a medical program, doctor-led program, and we are advised by specialists in the field of diabetes and obesity, ranging from endocrinology, dietitian, behavior science specialist, and psychology. So Roczen initially was launched in the UK about 4 years ago, right in the middle of the COVID pandemic, as a clinical service evaluations, or CSE in short, for the healthcare workers, doctors and nurses working in the National Health Services, NHS, which is sort of equivalent to our Ministry of Health Malaysia. So the Roczen protocol was successful during this CSE, and it was then launched commercially for the staff in the London Underground, Network Rail, basically the train drivers and bus drivers in the London. And then also the His Majesty's Prison and Probation Services, as well as various corporate companies in the UK. So 2 years down the line, in 2022, right after Raya, right after the pandemic settled. So we launched in Malaysia. So by conducting a similar CSE amongst the healthcare workers in Hospital Putrajaya, we are very lucky to be working together and advised by Dr. Zanariah in this CSE.
I think there are two really good takeaways so far. First is that it is not actually another medication on top of your current medication. And number two, the fact that you don't actually have to go to the hospital every time, and you have to go through the whole appointment process and the whole lining up process. And of course, a lot of people who do have diabetes are elderly, and so the children will have, it's just a lot of things in one. So, Dr. Zanara, let's talk about how you came to know about Reset Health and Roczen.
Yeah. So I've been actually personally interested in the area of lifestyle intervention, or actually, you know, preventive medicine in a way, because I've managed patients with diabetes for so long, and you sit in the clinic and you keep increasing their medicines, and their medicine list goes up, and along with that, very often their weight goes up as well. And deep down inside, a lot of them don't want, I mean, if you put yourself in their shoes, you don't want too many medications, and you would really harbor that hope that maybe to some extent you could reduce your medications. And I was very keen and kept up with the literature about how in other places in the world they were actually setting up physical centers and programs where they would have intensive programs in their center and get people to lose weight with a lot of motivation, and show that medication requirement reduces, and therefore healthcare cost also reduces. Yeah. And a few years back, along with colleagues, dietitians, we did a little study in our primary care clinic in Seremban, where people with diabetes on tablets, they were, put into a few groups. One just received standard care, the other received nutritional advice and motivational interviewing, some kind of behavior therapy. And at the end of 6 months, we could actually reduce the medications in a proportion of those on that arm, whereas the other arm, there was increase in medicines, so that showed that it worked in the local setting, yeah. There were also other studies being published as well from the UK, especially, but these are more sort of very intensive programs where they put people on total diet replacement and they lose massive amount of weight, but they're very carefully monitored. And it showed that if you lose 15% of body weight for a diabetic, you could actually reverse diabetes as much as 60% of those that are in the program, which is amazing, So when we heard about Reset Health and Roczen program, that was initiated by a Malaysian as well, back in the UK, with an interest to also have the second Reset Health sort of launch outside the UK, the first to be in Malaysia, and I was very keen to help out. And since it started out in the UK among the healthcare staff, that actually, piloted the program. So we thought in Malaysia, then also among the healthcare staff in Hospital Putrajaya, we could also, roll out the program because, just like, everyone else, healthcare staff also has issues in terms of weight and diabetes. So as Dr. Nick said, we embarked on that and opened it to our healthcare staff. And that included, a couple of doctors, a few nurses, some pharmacists, some radiographers who actually came into the program and had, good results in terms that these entirely virtually conduct the program, along with the care that they receive for their diabetes, can work hand in hand to actually get them better. So they were patients with weight issues, with pre-diabetes as well with diabetes. And there are success stories where, in fact, they could reverse their diabetes, reverse their pre-diabetes, reduce their medication list for blood pressure medicines, diabetes medications. And most of all, we also looked at their eating behavior because there were specific questionnaires that looked at eating behavior and also their psychological or mental health, which showed an improvement along with that, change in weight and improvement in their diabetes and what other medical conditions, but their, mental health got better, and their eating behavior got better. So it looked like quite holistic effect, and if you do have a workforce that is going in this direction, certainly we hope that they would probably work more productively, efficiently, and happily. So that's, yeah, so I've been very happy to be part of the sort of introducing the program, and following that, we've had further the program has been rolled out in among other healthcare staff in other parts of MOH as well. Yeah.
It's fantastic word. It can sound a little bit scary because you suddenly now have to make all these changes and your food intake is
It's not so sudden. In fact, it's as the word says, individualized, and it should be person or patient centered. So you've got to assess each and everyone, a different psychological makeup, different eating behavior and whatnot, and then tailor a program that can gradually be intensified, and because it's well supported. And I think Dr. Nick will tell you that Roczen has this what is different is it's mentor based, so they have that missing thing, which for us physicians that manage patients in clinic will give the advice, and then we'll refer to the dietitian. But after that, you're on your own. In that few months between the visits or consults, you're on your own. And you often don't have the avenue to contact back your healthcare staff in case you get confronted by challenges that you can't deal with. And that's what Roczen can do, because there is this mentor, and this between doctors' visits, you get this close two-way communication that deals with the practical issues, the everyday issues that people have when they're challenged about how to change your diet, how to move more, how to do this and that. Yeah.
Definitely helps because instead of talking to your healthcare professional, we're just Googling, and then when you Google, you find all these nonsense answers. You just like get so freaked out. So, Dr. Nick, can you share the outcome of the Roczen CSE in Hospital Putrajaya?
Right, definitely. I think the thing that you mentioned about Googling info can be quite scary because, yeah, we admit that there's a lot of noises all around us. People are advising us left and right. Sometimes they give tips, they forward some WhatsApp tips and some what's not, and then they Google and they didn't get the whole idea of what the suggestion was all about. So it's always best for us to have a trusted source of information, especially medically related. So it's something that we aspire to do. So in regards to Roczen CSE in Hospital Putrajaya, when we started out in 2022, it was a bit of a challenging time because number one, we started out right after Raya, and after Raya, immediately after the Raya Puasa celebration, that whole 1 month are very a whole month of celebration. People are going for open houses. In the working departments, they have open departments, kanduris, and all that. So we know it's going to be a challenging time around May 2022, and it was right after pandemic. The whole COVID pandemic was between 2020 and 2021. So in 2022, it was declared as an endemic. People are started to socialize again. They start to go out and see each other again. And naturally, when they see each other again, the more common introduction between us is, dah makan ke belum? Have you eaten? Let's go out and eat. What are you going to eat for lunch, for dinner today? So the whole bunch of questions is all resolved around eating. So I think when I joined in 2022, we recognized that this is going to be a challenging time, but I think it's not impossible. So when we started out, it is a 12 months program for all the staff. We see them every month. The doctors see them every month. And in between our monthly consultation, they will be given a mentor to guide them in their day-to-day challenges like, should I eat this? Should I eat that? So these are the role of the mentor to give non-medical advice. And any medical advice will be escalated to the doctors immediately. So there's a lot of conversation back and forth between the member, the doctor, and the mentor. And then because we recognize that it's among healthcare workers and naturally they work long hours, the shift can be challenging. So it does make sense for us back then to advise whatever that they eat, the when they eat, the what they eat, has to be around the accessible sources of food, around the setting. So I went there, I was looking at the cafe, the foods that they prepared. So I was thinking, what kind of advice can I give in regards to foods, the portioning, the sequencing, how you should eat, and what's not. So we give that advice amongst the staff, and then give them a lot of trust, a lot of support in a non-judgmental way. And by 1 year, we see a very good outcome amongst the staff. So on average, they reported about 7.2 kg weight loss amongst all the participants that need. So this is the average. So it can be as low as 3, 4, 5 kg all the way to 10, 15 kgs. So when you average out between all the participants, you get about 7.2 kgs and a waist reduction of 11 centimeter in average. So 11 centimeter is actually quite a lot on average alone. So basically you're reducing about 3 inches or more in terms of pant size. And then they reported improvement in their blood glucose parameters, reduction of medication, as Dr. Zanariah has mentioned earlier, reducing in the doses and the frequency of the medications. And also another positive side effects of losing weight, taking control of their chronic disease is actually their mental health improve as well. We did questionnaires on anxiety, depression, binge eating, and we saw a good trend of positive trend of amongst the participants who reverted with the questionnaires. And amongst those who are achieving this amazing weight loss, we saw that about almost 70% of them all achieving more than 5% weight loss. And between this, a subset of almost 40% actually lost more than 10% weight loss, which is actually very, very good, because we know those who are, like Dr. Zana said earlier, if they head towards the trajectory of losing 15% weight loss, then their diabetes will be in control as well. So we have that. Those participants are in the cohort as well. And then as a medical program, we can't say it's really medical if we don't make it evidence-based. So these are the evidence of the program that we have conducted for that 1 year, and we've presented this outcome on last year's Malaysian Association for the Study of Obesity conference in the form of poster presentation, and show it to the other participants and judges. Alhamdulillah.
I think that's right, because if you don't have the data to back it up, it would just sound a lot like a very idealistic idea instead of something that's proven. But here we can see. So, Dr. Zanariah, what do you think about the outcome of the CSE?
Oh, I'm actually quite impressed with the outcome among our Hospital Putrajaya staff. Yeah, of course, what we know is sometimes after the first 6 months or 1 year, what we need to see is maintenance of that, benefits that they've achieved. And this is also seen in other studies that have been published, that sometimes there is what we call weight regain. I mean, we're only human, that, after you lose out on complying to the advice given, and slowly the weight regain. So that is a big challenge. Yeah, but we've been really positive outcome, and similar to what's seen in the UK. The UK's results have been extensively published, and so we've seen that this can also, the same protocol can be Malaysianized and can also work for Malaysians actually.
Can you share from your own experience, that Dr. Zanariah, what health benefits can patients actually expect from reversing their obesity and type 2 diabetes?
Yeah, well, when you are obese, I did peek at the questions. There's someone very eagerly asking about insulin levels. So when you're obese, our own insulin that's being produced actually fails to work efficiently. And insulin is such an important hormone, because it's like the key that opens the door to helping glucose enter the cell, whether it's the muscle or the liver, so that that glucose doesn't accumulate in the blood and circulation and cause damage to the blood vessels and all the organs. So when you're obese, this insulin resistance is a very important feature. And also what we didn't realize is that the diabetes is not only a disease of sugar, it's also a disease of fat. So there's actually fat accumulation in places where we didn't even imagine. Inside the pancreas, fat accumulates. Inside the liver, fat accumulates and deposits. Inside our skeletal muscle, our muscle, even our heart muscle. And it scares you when you think that, the fat is slowly, is all there, and it can gradually disturb the function. So with weight reduction or reversing obesity in a big way, people first aim at 5%. It already translates to many health benefits. A 5% weight loss from your baseline, if you're overweight and obese, will translate to improvement in blood glucose. It comes down a bit, blood pressure can come down. But if you lose 10%, it could really have what we call disease modifying effect. That means it can change the physiology 10 to 15%. So you start seeing, the fat that is probably in all pancreas and fat can actually come down. The only thing is we can't measure it. We can't have a little telescope to see, oh, you know, my pancreatic fat is reducing or my liver fat is reducing. But in the studies, they are showing, because they're able to do this, like take biopsies of the pancreas and biopsies of the liver in small numbers of people in the trial, they've seen that with the weight loss, you can improve. So the enlarged liver, which is full of fat, fatty liver, can start reducing in size, and the cells can start having less fat inside. And the amazing breakthrough in that direct trial is they found that on the MRI, when they looked at the pancreas, because the MRI is a scan that can look inside, and they can see that the fat is actually reducing in the pancreas as the patient loses weight. And when they measure the insulin, the capacity of the pancreas to produce insulin, because I know I might be confusing some, because I'm saying that there's insulin resistance, but there's also a problem of not having enough insulin being produced because there's too much injury to the cells in the pancreas, and that recovers, you know. So now we know that, when you lose weight and you maintain that weight loss, but it has to cross a certain degree, 10 to 15%, then things start to get back functioning better. You know, the pancreas recovers, the cells start to produce insulin again. You're then able to manage, the glucose doesn't spike so much, because basically insulin helps you reduce the spike after food. You know, so, but it's beyond that benefit. You know, there's so many other benefits of reversing obesity. We're just talking about metabolic, you know, but then you go to look at cardiac punya benefits, because you reduce the cholesterol, you reduce the blood pressure. Therefore, all the factors that damage your blood vessels will be reduced, and then therefore you will reduce cardiac events, heart attacks, you reduce strokes. Yeah. Weight-related disease, another big thing is they call it sleep apnea. You know, you get so obese that, you know, your soft tissue in your airways swell up so much, though when you fall asleep, that your upper airways close, you know, and you don't get enough oxygen, and then, you know, things happen. You wake up, you have interrupted sleep. But sleep apnea is also potentially life-threatening, because in the long run it can lead to heart failure as well. So this actually can reverse with weight loss. Fatty liver, which actually, if goes on for years, can become chronic liver disease. Liver failure can reverse. Chronic kidney disease related to obesity. If you lose that amount of weight and things get better, a lot of things get better along with that, can also retard the progression of your chronic kidney disease from going right head on into kidney failure and dialysis, you know. And, you know, other things like joint problems, which are related to obesity, you know, arthritis, women's health issues. And a lot of women are not fertile now because of being overweight, obese. They have this condition called polycystic ovarian syndrome. And if you reverse obesity, then it start, you know, hormones start to work better. Yeah. Not much highlight, but certainly there is an association with obesity and the propensity to get cancers. And everybody's so scared of getting cancer. And we know that, you know, obesity is related to ovarian cancer, is related to certain cancers, pancreatic cancer. We can't prove that reversing obesity will reverse cancer, but we know that it's associated with increased cancer risk, because basically when you're obese, there's a lot of this extra inflammation happening and injury to your cells. You know, it's hard to explain the processes in between. So by combating obesity, you know, you can actually reduce, you know, this unwanted inflammation and cell injury that's happening. Difficult for us to picture the micro level. Yeah, but that's what we're aiming at.
Okay,
Thank
so
you.
talking about weight management and losing weight and all this. And Dr. Nick, currently there are a lot of weight management programs in the market. You know, we always hear about them. And Roxanne deals with obesity too, aside from diabetes. You stated earlier that Roxanne is a medical protocol. Why is that?
Yes, from Dr. Zana's answer just now, you can see that there's a lot of medical issues happening in surrounding obesity and type 2 diabetes. So we will need someone who can actually digest this information from the medical standpoint and actually laymanize it to our non-medical members. So this is basically our role as doctors in Reset Health. It's a medical protocol because we need doctors to lead the program, and we need for our members to be able to understand the issue. It's not just about weight, not just about sugar per se, but as Dr. Zana said, there's also issues regarding sleep disturbances due to the thick neck related to obesity. And then there's the potential issues of developing kidney problem, heart problems, joint pains and all that. This is all related, and sometimes not many people can see it from the bird's eye view. So it is our role to actually take this information and put it in bite size so that we can put them in our consultations every month for the next 12 months. So I think what I wanted to really point out that we play an active role. There's a constant communication and engagement with the members. So we don't really, although we do have an app in the UK, but in Malaysia, we decided to just not rely on apps for automated guidance, but really ask them to contact us using whatever channels that are available. We can see them using video sessions like Zoom, Google, and also communicate using WhatsApp, whatever that's already available, so that there's no really any reason for them to avoid the contact. And then as we closely monitor the progress as well, and then whenever that we see that the result is swaying towards the negative side, so we will be able to tackle it immediately. Hence, the monthly consultation is there. So we track the health biometrics and then discuss this progress during the monthly consults. And then part of our role, we also write to their primary doctors, the ones that referred them to us in the first place, or the ones that they are already seeing in clinic kesihatan, GPs. We write to them and say, this is your patient progress. So something good, something bad, medications. So we talk about it in the referral letters that we send to these doctors as well. So also as a medical protocol, we publish our outcomes and in the journals, as mentioned earlier. And earlier on, I said that we work with NHS hospitals amongst the healthcare staff. That was about 4 years ago. Now we already been recognized as one of 4 programs by the recommendation body in the UK as a digital weight management service. Doctors can prescribe to the patients in the NHS, which is sort of similar to our Ministry of Health. And then we have various care models that we come up with, not just one-on-one, but also targeting public health, and also to see whether if there is a need for them to receive medications at chunks, which will be explained later on.
This hand holding per se, I think is very, very important.
Yes.
Yeah. Because it's, again, as Malaysians, it's very easy to go down that slippery slope of like, oh my God, nasi lemak, or like, tak tahu dia diet makan bihun, same thing. So, Dr. Zanariah, is obesity a result of a person's lack of control, like myself, or something more? What do you think?
Yeah, well, the easy answer is multifactorial lah. Yeah, that to begin with, there is this genetic predisposition for obesity. So actually, if your family members are seen to be obese, then there is a highly likelihood of inheriting that genetic predisposition. But it's also your environment. So if we're brought up in an environment that is actually non-conducive to healthy lifestyles, then that also contributes. Yeah. So, of course, medications that some people may use for different diseases. One thing that's a bit worrying trend is sometimes our Malaysian, they actually buy medications outside that they don't know what's the content, and sometimes they have medicines outside and they may be spiked with some steroids, so that causes some problems as well, or weight gain as well as diabetes. Yeah. So so that's a few of the factors that do contribute to unhealthy weight. Yeah.
I think unfortunately with the emergence
Physical
of
inactivity, I forgot to mention also, sorry. Physical activity, yeah. So I think we saw in our national surveys, they also look at the physical activity profile of Malaysians. I just sort of flipped through in 2019, that was the latest published survey, shows that about among the diabetics, 1/3 are physically inactive. Yeah. Of course, you will probably ask what is the definition, but and this of course is age related, yeah, so that is something we do have to tackle as well. Not so much just you need to exercise, but you just have to reduce your sitting time, break up your prolonged sitting, which is now becoming a common habit. We just sit down for hours without realizing, and then getting your step count up gradually, and also in between that having some dedicated time to exercise, but also conscious of the fact that it's just reducing sedentariness and being a little bit more active and gradually changing your behavior in that way.
I feel super attacked right now. I'm a lazy person. I like to watch TV and snack. So Malaysian. The next question, this one is for Dr. Nick. So, the Malaysia Kini article that was published on 19th February mentions that Roczen is recommended by the National Institute of Health and Care Excellence UK as a digital weight management platform. This is something new. I've never heard of this one before. For NHS England doctors to refer their patients to. So, can you elaborate on this, please?
Sure. Basically, just the definition, NHS equals to our Ministry of Health and also the National Institute of Health and Care Excellence, or NICE in short. It's sort of like a body that provides recommendation on best practices. In here, in Malaysia, it's also done within the Ministry of Health by producing the clinical practice guidelines to the doctors to guide their practice on. So in the UK, I think it's similar in Malaysia. They are overwhelmed with the number of patients having complications related to obesity and diabetes. So eventually they recognize the need to partner up with private providers. And Roczen has been selected as one of the programs to deliver this specialist weight management programs to NHS patients, as well as also providing virtual prescription of medications that suppress the appetites, called the GLP-1 receptor agonist. You probably have heard about Saxenda, Ozempic in Malaysia, but in the UK they prescribe Wegovy. So, and then an independent review shows that Roczen has the best outcome out of these four selected programs regarding managing obesity and diabetes and their outcomes in the UK.
Okay, so Dr. Zanariah, from an endocrinologist point of view, are there any misconceptions? I'm sure there are about lifestyle interventions for obesity and also type 2 diabetes. Any that you would like to address?
Misconceptions, yeah. Well, I think what I would want to specifically say is that probably in Malaysia itself, I don't know before Roczen, is that we don't really have a proper structured lifestyle intervention program. What we do have is we give general lifestyle advice. Very often we're not very prescriptive in giving, exactly what nutritional advice is usually given by the certified dietitian. Physical activity experts, we have few, so depending, I'm not sure how the doctor does give that prescription. For us in Hospital Putrajaya, we have the benefit of our physiotherapists, although they are usually trained to treat other, but they do have a special focus on obesity program to give a prescription for that. I think having a comprehensive program, that's our weakness, that we probably are very centered on, for doctors at least, on medications, so much so that we don't give the similar focus on actually a structured lifestyle program. So I am really hopeful that there's more efforts. Just like Roczen is one option now in Malaysia that's available out there. We hope we're in discussions with the MOH that I think programs like this should be an option for those who can access to it in Malaysia, and hopefully we follow suit with other, options of structured lifestyle intervention programs that are supported by qualified individuals. That means if we were to run the program, we should be trained in the protocol of the program, pick and then dedicated staff also that are there to run the program, entirely, and then also look at the outcomes as well, share the outcomes and see where it can be improved. So that's what I'm hopeful for. I think we really in our country need to invest in lifestyle intervention programs because it's a way for preventive medicine, which is really the way to go. Because you can't sort of every survey keep seeing the trends of all your metabolic disease going up, which are weight related. So have to have somewhere, have a breakthrough. Yeah.
Well, this is a breakthrough indeed. And Dr. Nick, how do you deal with these misconceptions and barriers as a doctor in Roczen?
I think the fact that we are a virtually conducted program and we have the opportunity for constant communication because people don't have to actually take leaves to come to see us. So it's very much accessible for them, and the channel, the WhatsApp channel, our consultations that we did every month, they are all methods of communications that are available to them. They can reach us anytime, and eventually there's that trust building between our team and the members. So they become more and more comfortable sharing their skepticism, and we tackle it one by one, from movement, activities, sleep patterns, stress management, and other than their eating habits. So these are tackled slowly, steadily. We don't give them impossible targets, but work with them on what kind of target they are hoping to achieve. So I believe that these are the main points of methods that we do to address the misconception. There's always going to be skepticism, perceived understanding of the disease before they join, but we were able to tackle it slowly and steadily using the channels that we have right now.
Dr. Zanariah, I agree that communication is definitely key. And I think the best thing about what we've talked about tonight is the whole accessibility-ness of this. Like, it's so easy to be able to contact your doctor or your healthcare professional as compared to what we used to do before. It's like Google, what is wrong with me? So what do you think, Dr. Zanariah? Can it be done in the current healthcare settings, meaning between MOH or private doctor interacting with their patients? Does the current healthcare system that we now have the capacity to do this constant back and forth communication?
Right. I can only give my personal opinion, of course. Yeah. So right now, for example, as doctors see their patients, and in what I can only share what's happening where I practice in public health setting, yeah, or in government hospital setting, is when we see patients with diabetes or obesity, it's usually at intervals of maybe 3 to 4 to sometimes, if they're very good, 6 monthly. Yeah. So that's quite far apart, and in between, very often they're on their own, as mentioned before. Certainly, we haven't sort of ventured towards seeing how, if they were on their own program, because some of them do join their own programs, they go to their own gyms or they join on their own because of their own self-motivation, and self-inspired, and they do well. But we have yet to venture into a real sort of partnership, with outside, for example, like with Reset Health and Roczen, for a larger number of people, for the majority that needs what we call this lifestyle intervention. So for the moment, what we do is we're still with that, refer to our dietitian for individualized care and refer to the physio, but that probably can only address, a small number, percentage of the patients, and sometimes willingness for patients to adhere to their advice and come for regular, as you mentioned before, because it's physical, you know, um, is a constraint as well. So I'm really eager to see how this can actually, grow in the future. I'm hopeful that possibly for us, whether it's in government health practice or private health practice, that we take into account what's available out there. If it's evidence-based and the outcome is seen, then we should actually be able to at least tell the patient that this is actually something that's quite sound. It's sound and and well recommended. Um, and that may actually steer them away from actually just trying, because the doctor is keen to actually tell them the available options rather than them finding out what's there in the social network, and joining all kinds of things and doesn't work, and buying all kinds of products that doesn't have evidence. Yep.
Yeah, social media can be a deterrent as well, because people tend to hear like, oh, this one went viral. Oh my God, must be great. And then now, next thing you know, it's like thousands of people buying this one thing that's not even, I don't know, maybe it doesn't even have the stamp of approval from the government. So it might not even be safe, That's another story for another time, I think. So next, just want to ask Dr. Nick, can you share some inspiring stories that you've seen from Roczen members who have reversed obesity and type 2 diabetes?
Yes, definitely. I think most of our participants, they are able to lose weight, control their sugar. But some of the more inspiring stories I'm hearing from this participant, there are a couple of female participants who have not had their menses for many years, and they were trying for babies. They were trying to get pregnant without success, and then they were told by their doctors to control their weight and sugar before their menses would return. So they found out about our programs and they joined the program. And then initially with a bit of skepticism, but as the months move forward, and then they abide to the protocol, and we see changes in their weight and sugar control. Then suddenly, I think what happened was 3 to 4 months down the line, before they finished the program, they got their menses. So they think when I saw them during the consultation, they were very excited to tell Doctor, my menses have come back. So I said, wow, okay, so that's a really good step. So yeah, and then I think that's the first step for them in order to really try out for babies. We can't really control whether they get or didn't get babies, but restoring this menstruation will be a first step. We did have to stop a couple of participants from proceeding because they got pregnant along the way, because I think with their health improved, they didn't have that much issues to begin with in terms of menses and all, but because of they're becoming more healthy, I think the body reacting in a very positive way as well. And at month 3 and month 4, once they lost some weight, they got pregnant. So we say, okay, that's not your weight loss is no longer your priority because you're getting pregnant. Definitely there will be increment of weight. So we had to stop them as well. We sad to see them go, but inspiring all the same as well. And then we had another with very severe menstruation pain and was told by her gynae surgeon that she needed a uterus removal, basically because it's too painful for her every month and it's not well controlled by painkiller. She was also told to manage her weight and sugar as an option. She came to see us, did the same, and I think alhamdulillah the menses is no longer painful for her back then. And the gynae surgeon, when we communicated with him, we decided, you don't really need the surgery because there's no pain. So if it's not broken, why fix it in some sort of way? So she happily continued with the program for 1 year, and I think exited the program very happy with self image improvements and what's not. I think that's very inspiring for me to hear this personal experience from other members in the program. Aside from weight loss and diabetes control, what else do they achieve by taking control of their life?
Absolutely. These were really great stories, success stories. Dr. Zanariah, my mom always tells me, you're getting older, make sure you watch your food intake because I don't. She tells me because if you get diabetes or if you get anything else, you will end up taking a medication for life. Which brings me to the next question. A lot of patients do wonder, do they have to take their diabetes medication for life? How do you address this, doctor?
Yeah, well, we broached that as well in the beginning, saying that, diabetes we used to think it's a progressive disease. But again, if you do manage to you do good weight management and able to keep your weight down in the ID levels, then the the dependence on medications can actually come down. Yeah, but that has to be carefully guided by your treating doctor, who will tell you that, look at this, your blood results are showing it's getting better, and maybe so also your glucose monitoring at home is also showing better levels. Then we can come to an agreement. Let's try to bring down your dose, or let's try to drop one medicine down. And this can, in fact, be carefully done over the subsequent months. And in those who are really successful to organize their lifestyle, sometimes they may not necessarily lose a lot of weight, but just doing the right things in terms of nutrition and movement and improving what happens with insulin in the body, then we can work with reducing their medicines, as I said. And the earlier one realizes this, that means as upon diagnosis, or even when you're just not diabetic yet, but somewhere in the borderline, like pre-diabetes, and if you set in those lifestyle changes, get the weight in the right direction, you can reverse the pre-diabetes. You don't even have to step forwards into the diabetes phase, So I think more and more people need to be aware of this so that they work with their treating physician. And but you have to show that you're committed to wanting to change. And a lot of people haven't come to that realization that, oh, I'm ready to change and make these changes. And you can't push it when they don't want to and they're not ready. So this thing is only successful when people are ready and they're looking to do something. So that is it. How do you awaken that, feeling in people? That is also something that we need to look at. Yeah.
Motivation, that's the hardest part. Dr. Nick, speaking of patients being able to lower or stop their medicines, have you seen any cases amongst the Roczen members who are able to lower or stop their medications completely?
Definitely, yes. But first and foremost, I would like to address we are not anti medications. We do recognize it as a tool to manage diabetes, especially. But as Dr. Zanariah has mentioned earlier, when the parameters are well controlled, we can come into agreement in order to reduce it. And we've seen a lot of participants being able to reduce their dosage of medication with the agreement between the Roczen doctor and the primary clinician that is treating them. So we do write back and forth, discuss the patients, and then we come into agreement. Of course, patient will be very happy that the medication has been reduced. But there are instances as well, medications are needed to actually first manage the condition, but with the aim to stop it in maybe 6 months time or 1 year time once the parameter have been normalized. So this is something that we are looking forward to introduce in Malaysia with what we call as Roczen Plus. Not yet in Malaysia, but upcoming as well. So combination of lifestyle and medicine can be a very powerful thing as well for those who are living with diabetes and obesity.
That's the ultimate
Maybe
goal.
I just wanted to say something as well. Sorry to butt in. That you thank you, Nick, for reminding me. Because I don't want the audience to suddenly say they want to work to stop their medications entirely. Your treating doctor will know what medications for diabetes may still be necessary, because one is just to reduce glucose. The other is what we call medications that are needed for, to impact on complications. So we know, for example, that diabetics sometimes after some time they get protein in their urine and some kidney injury, and they may have already had a heart attack. So there are times where the doctors in these situations where people already have complications may really insist on their patient that even though you're doing better, but these medicines are not just for your glucose, but they're also to ensure that your kidneys don't progress and your heart is in a good way, because these drugs actually impact on those outcomes. So just to also remind the patient, have a good conversation with your doctor. But to do that, you have to be you need to be interested and you need to have some understanding, read, ask, and it'd be so nice if we have a good conversation with the patient. Sometimes the patient comes to clinic and you say, there's not much conversation from the patient, because all they want to know, what are my test results? Yeah, and then what are my medications? But we're a lot of us are interested in making it a little bit more, holistic kind of approach. Yeah.
Okay, so Dr. Nick, in the article that we talked about earlier, it's mentioned that Roczen is HRD Corp claimable. What does that mean? And can you elaborate?
Yes, definitely. I think there's the trend reported by Picasso. I think they released a guideline in 2016 reporting on increasing trend of healthcare expenditure regarding diabetes, heart disease, high BP, and high cholesterol for the preceding 10 years. And then what they recommend, as people spend a lot of their time working, about at least a third of their day working, 8 hours out of the 24 hours working. So it makes sense to have a program, workplace related program, that caters to this health of the staff, rather than leaving the staff to work so hard and then go back home. They don't have time to actually prioritize health after working so hard throughout the day, because there will be other commitments, children, family. Basically they just wanted to rest, they just wanted to watch Netflix, for example. So it makes sense to actually start it from the workplace, and then with by conversing with a lot of stakeholders in the workplace area, the HRs especially, we understand that medical benefits are attractive factors to get people to work in a workplace setting, but it is a rising trend of spending as well for the company. Good for the staff, but not so good for the employees, because more and more money are being spent on healthcare expenditures. Medications are usage are on the rise. People are admitted to the hospital, get complications, get surgeries, and all that, all related to obesity and diabetes. So something that they asked us to do is to see if our program, which basically we are training our people to manage their obesity and diabetes to the point of reversal, instead of just telling them what to do, we are training their behaviors, changing their behaviors in a small bits of size. So we received an understanding from HRD Corp on how to go about it, and we got certified, and employers can finally tap into this HRD Corp fund that they are paying every month to HRD Corp in order for their staff to subscribe to Roczen. A little bit on this, the employers pay HRD Corp. It's a levy of 1% of the salary of the staff they need to pay every month to HRD Corp, and they can only access this fund if they send the staff for training, for self-improvement, for the benefit of the company. And health programs is not, there's not many health programs that is certified. There's a lot of self-improvement, behavior, confidence, improving your confidence, talks, and all that. So Roczen being HRD Corp claimable will be some sort of like a game changer, because training a staff to really take charge into their health while at the workplace with other colleagues, they can do it together. Sometimes it's very nice to do it in a group rather than single person. It can be a lonely journey for some individual members, but in group we see powerful trends as well. Like person A is encouraging person B, person B is encouraging person C, and then they call out each other as well. Some people, when we go to companies, had this session with them, and then some people say, I don't lose a lot of weight. Suddenly their friends call out to them, oh, I saw you eating ice cream yesterday, that's why you don't lose weight. So that is really, there's a nice interaction between all the staff and their group together, in the same workplace setting without having to take MC, without having to take leaves to see us as doctor, because the HR understand that they are doing it for the betterment of the company. So I think this is why eventually we work towards HRD claimable status, and finally managed to get it and launch it. We have to launch it with some companies, and we are hoping to see more companies come in and subscribe as using this HRD modality. Because eventually, when we reverse obesity and diabetes, we actually are in the position to prevent 200 other comorbids like hypertension, heart attack, stroke, cancer, kidney problems. We prevent serious disease instead of treating current one. We prevent other diseases from appearing in the first place.
That's right. Now, Dr. Zanariah, before we end our discussion tonight, earlier we sort of touched on motivation and being able to take that first step. So what is your advice for individuals who are just beginning their journey, maybe, trying to reverse obesity and type 2 diabetes through lifestyle changes?
Okay, so where I work, usually, besides the doctor seeing, we also have what we call our nurse educators. So often they always have that approach to actually giving that support and motivation to patients. But certainly that's important to work on that. Yeah. I think really be ready. In fact, treatment is patient centered. The patient is the most important member of that care team. So if you are actually interested and committed in your disease and management, that really makes a difference, to your care. That would be my advice, to be well informed on all these health issues, and prevention is always the better path. If you are obese but you don't have pre-diabetes or diabetes, then you can prevent it by watching your weight. If you have pre-diabetes, you watch that, you can prevent diabetes and go back to no pre-diabetes, and so on and so forth. Early diabetes, work well and with your healthcare provider, see how you can actually address the weight issues and lifestyle intervention, and you can then also possibly reverse from early diabetes to milder pre-diabetes and backwards. Yeah, but of course the approach is individualized in all ways, but really would encourage all to open up your mind that that lifestyle behavior change is a major component of managing pre-diabetes and diabetes. Yeah.
Mesti ada kesedaran. That's the most important first step. Now, before we end tonight, Dr. Nick, is there anything else you would like to add?
Yeah, I agree totally with Dr. Zana. It has to be patient-centric, and we are really moving from curative sick care to preventive healthcare. This is something that has been emphasized in the healthcare white paper that has been released last year in October. We wanted to really focus on preventing. Prevention is better than cure, right? I think everyone has heard of this saying, and what we want to do is really to help each person who have this chronic disease, obesity, type 2 diabetes, to really take charge of their health. What we can do is they can join the program, they can be with us for the whole 12 months, and then after that they can actually be empowered with enough knowledge to actually go on and be prepared to face the challenges. They have kanduris or open houses, no problem. I can actually go and I can actually manage my weight and sugar the next day. So we wanted to instill them this training, this knowledge, for them to really face on this program, because it's not going to be easy, but with more and more people taking charge of their health, it's definitely not impossible. So to really support those members who are really wanted to take charge of their health, Roczen Reset Health is very happy to announce that we are giving complimentary 3 months program for the Roczen program. For those who actually use the QR code and register with us. Bear in mind, it's a medical protocol. We need to screen you for some medical issues as well. There will be eligible criteria and all. But if you are successfully enrolled by the end of March, you'll be able to take to really have this free 3-month subscription, which is actually worth 450 ringgit. The Roczen program runs at 150 ringgit per month. So by having this 3 months complimentary, you already save almost 400 ringgit already. And then you'll be able to really understand what we are doing and really take charge of your health, prevent before curing. And if you are really keen to know about it, reach out to us using our website, WhatsApp number. You can also probably ask your HR to contact your medical card providers. We work with a lot of TPAs as well. So there's a lot of avenues that we can actually use to help you. And there's also that HRD Corp as well. Companies don't really have to come up with separate budget to fund the program. They can actually use their training program to fund this. Yeah, so I think that's it. Seize the opportunity while it's still available.
Yes, well, it has been an amazing, amazing discussion tonight. And this is a wrap for the insightful discussion on reversing obesity and type 2 diabetes. I would like to extend my sincerest gratitude to our esteemed guests, Dr. Zanariah Hussein and Dr. Nick Adzrul, for sharing your expertise and shedding light on this critical topic. Yet that as Malaysians, a lot of us are actually, more than we would like to admit, are actually interested in this topic. Your insights have definitely been invaluable. So now to our viewers at home, thank you for tuning in, being a part of this important conversation. Now remember, whether you're struggling with obesity or diabetes, or simply striving to have better health like myself, there is hope and there is support available. So take the first step, like Dr. Zanariah was saying earlier, towards a healthier future by seeking guidance from healthcare professionals and adopting positive lifestyle changes. Now, as Dr. Nick mentioned a while ago, one possible first step would be sign up for Roczen and witness your quality of life improve. And not just that, you could also stand a chance to win a free 3-month subscription worth a whopping 450 ringgit. This is a really, really great deal. So you can also visit mk.my/Roczen, like you can see on the screen right now, or you can simply WhatsApp Roczen at 017-373-1573 for more details. Maybe you have some questions. Now, before we go, I'd like to remind you to stay connected with us on social media for updates on upcoming episodes and to continue the conversation. Your feedback and suggestions are always welcome. Until next time, take care of yourselves and each other. I'm Nadia Nazir signing off from Health Matters. Good night.
My name is Nick, and I'm reversing type 2 diabetes. I was diagnosed 24 years ago, having just come off an intensely stressful time working as production supervisor on the movie Evita. I was told I'd be managing diabetes for the rest of my life. It became crazy. I was injecting myself with insulin in the stomach 4 times daily, and it was getting worse. It's this idea that you have to live with it, when in fact you can reverse it.
Reset Health is a carefully designed program by leading medical experts and researchers, bringing specialist doctors, psychologists, dietitians and nurses into a protocol to help reverse type 2 diabetes and obesity.
Up until now, the common treatment for type 2 diabetes is designed to maintain blood glucose through multiple medications, which includes insulin. At Reset Health, we show you how to lower your insulin resistance and help reverse your type 2 diabetes. Not surprisingly, this can also work for obesity.
We start by taking a medical history to understand metabolic health, looking at blood profiles, accessing nutritional information, sleep, physical exercise, and then provide you with an individualized program that sets 3 key targets for metabolic health from several possible measures, including blood glucose, body weight and BMI, blood pressure, cholesterol, and liver tests.
Within Reset, we combine the latest nutrition research with cutting-edge fasting protocols to meet your unique needs. Obesity and type 2 diabetes are both complex chronic diseases. For anyone making changes to their lifestyle, it's a very personal and emotional journey. I'm a senior specialist dietitian who has worked with people living with obesity and diabetes in both the NHS and academia, and understand the challenges people face when making lifestyle changes. At Reset Health, our team will be here to guide and support you along this journey.
I have just spent 15 weeks helping the Red Cross and Los Angeles School District with their scheme to feed 500,000 kids a day. These children rely on school meals to avoid going hungry. We've served over 40 million meals so far during this pandemic. Reset Health has restored my health so that I can now help others.
I was in charge of some 15 COVID wards, and it saddens me that a large proportion of those who unfortunately die are patients with type 2 diabetes and obesity.
Having just worked throughout the COVID-19 pandemic, I was witness to something which wasn't so obvious before, that the epidemic that actually we are suffering from is obesity and diabetes. I spent 2 weeks of the peak in ITU supporting my ICU colleagues, and seeing the types of patients that were on ventilators was stark, because I think about 90% of them had diabetes.
The alarming figure is that 1 in 4 COVID-19 deaths are diabetics. This makes me so relieved that I've changed my relationship with food and reset my own health.